Hi everyone. I wanted to make a video about the topic of sitting. And the reason I wanted to do that is because I find that a lot of our practice members spend a lot of time sitting. Some of them are commuting to work in the morning. Some are spending time at administrative jobs where they're sitting at a desk for long hours. There are others that, when they get home at the end of the day, they're sitting for 2 or 3 hours at a computer or watching television. We actually live in a society in a time where we do more sitting now than we ever have at any point in the past. And the first thing I want you to understand is that sitting is a really unhealthy position for your body, specifically when you're sitting for long, extended periods of time without interruption. And the World Health Organization has found that inactivity is the fourth biggest killer of adults, and it's responsible for 9% of premature deaths. Sitting has been implicated in conditions such as type 2 diabetes, cardiovascular disease. There was even a study that was published in the British Medical Journal that found that people who sit excessively are at an increased risk for certain kinds of cancer, uterine cancer, colon cancer, and lung cancer. So the question becomes, what happens if you're one of those people that has a job that requires you to sit for a large portion of the day? If you've got a desk job, what can you do? First thing I want you to understand is that even if you're somebody who gets a lot of exercise outside of your sitting hours, you're still at an increased risk if you're sitting without interruption. That's what the research tells us right now. There's a book called Sitting Kills, Moving Heals, and it was written by a woman named Dr. Joan Vernikos, who was actually involved in the NASA space program. And in her research, she found that it's far more beneficial for you to stand up and sit down 32 times throughout your workday than it is for you to stand up and sit down for 32 minutes straight right at the beginning of your workday and then sit for the rest of the day. So she had introduced this concept called interrupted sitting. And what the research is telling us is that what's most important is the amount of times, the number of times that you interrupt sitting throughout the day. What I would encourage you to do is in your workstation to find a timer on your computer or on your smartphone and have it set to go off every 10 minutes. Now, when it goes off, you don't need to interrupt the work that you're doing. You simply need to stand up and sit down 5 times in a row. If you want to make the movement more beneficial and more challenging, when you stand up, you can jump before you come back down. That's what we call a jump squat, where you're standing up, jumping, and your feet are hitting the floor and doing 5 jump squats in a row. If you were to do that, if every 10 minutes you were to interrupt your sitting, that means that if you worked a 7-hour day, for 42 times throughout that day, you would be interrupting your sitting posture. And that literally is going to eliminate a lot of the risks that you would have with prolonged sitting. The problem is that many of us get absorbed in the work that we're doing, and we find that, we look up from our work 2-3 hours later, we realize that we haven't taken a break for an extended period of time. The other thing I'd recommend you do is think about what modifications you can make to your workstation. If you have the option of creating a workstation that is a sit-stand station, there are a lot of devices that you can get that will mount to your desk that have a telescoping arm that can actually lift your keyboard and your monitor up and then lower it back down. So you can have a station that alternates between a standing and sitting workstation, which is a terrific way to eliminate the amount of hours that you're sitting. I would recommend as well that you get some form of active sitting solution. In our office, we have these inflatable bladders. They're called a sit disc. And you can purchase these sit discs just to rest or to sit on your regular chair. And what it does is it engages your core muscles and your pelvic muscles to keep your body moving even while you're sitting. Another great solution is to get like a big exercise ball. We have behind our desk, one of our girls uses an exercise ball to sit on, which is another way to keep your body moving while you're sitting as well. Even just simple modifications to your workstation. You can set up your desk in a way that you have to get up to go and get to your printer or to go and reach certain files. Anything that you can do that will encourage more movement. If you're in an office environment where you interact with other coworkers, instead of sending them an email, why don't you walk across the office to speak to them? That gives you an excuse to get up and go and communicate with them directly and to get your body upright and moving. Anything that you can do that is going to increase the number of steps and the amount of moving that you're doing throughout the day is going to be beneficial. A lot of folks have things called things like pedometers and fitness trackers that track the number of steps that you're taking each day. Those are a fantastic idea. You could have the challenge of trying to take more steps each day than the day before. You could park your car further from the entrance to your office and start, walking a little bit further to get into the grocery store, to get to work, different things like that. Taking the stairs instead of the elevator. Small modifications like that that increase the number of steps that you're taking throughout the day are really, really important to do. I hope this video has been helpful. I just want you folks to understand that it's not so critical that you exercise intensely to reduce your risk. It's more about body movement throughout the day. Make sure that you have a habit or a pattern that you're creating of interrupted sitting and regular movement throughout the day, and it will have a really profound effect on your health. If you have any questions about your workstation and what could be done to improve it, by all means give us a call at 323-9100. I'd be happy to speak to you. You're also welcome to email us at info@gracechiropractic.ca. Thanks. Have a great day.